this is cute. Oh, wow, this is cute. Look at that. These are the plants and what they do. All the plants and what they do. All the plants going up. It's in a healthcare setting. The healing garden. Oh, that's why it's called the healing garden. Excuse me, how you doing?
Sorry, you can go up.
Okay, I'm going out. It's PT, right?
No. Women's health. Or actually.
Yeah.
Yeah.
Right here or right here? Check in. Garrett. I just called her and told her I was looking for a park. She said okay. Or what she called me.
And you're still on Toledo?
Yes.
Same health insurance?
Yes.
You can just have a seat for now, okay?
Yeah. There's no parking around here. Tired. Yeah. Hey. Want me to come?
Yeah.
Coming. I'm a little slow.
No worries. We're going to be back here today. I'm Lisa.
What's up, Lisa?
Nice to meet you.
Nice to meet you, too. You said my name good, Lisa.
I did?
Yeah.
Oh, good. I was going to say. But I'm saying it right.
Most people ask first.
Oh, really?
Mm-hmm.
Well, I think because maybe I asked you last time, so it's stuck in my brain.
Oh, yeah.
Oh,
yeah, because you felt bad. Yeah, I remember that. Okay, cool. Stay right here on the table.
On the chair is good for now.
Perfect.
Okay. So we're a little lucky today.
It's just consultation, right?
Today's an eval, yeah.
Yeah.
But we got a little lucky because my person right after you had to cancel because they're sick. So
Oh, good. We got
that
lucky.
means we don't have to rush you out of here, which is good.
That is
we can
good.
actually kind of see what's going on and take a little time with it.
All right.
Okay?
Yes.
Where'd you end up finding parking?
I just went on and parked in the thing, and then as soon as I finally paid, 2 parks came up. As I was walking up here, 2 parks opened up, but they was gone about the time I turned my head.
It goes quickly, from my understanding. I usually take the bus, so I was like, I know it's hard, but I don't need to
Next
go.
time I know, I'll just come a little early. Usually when I go to the places to UCSF, they got a parking garage somewhere, but
this one, I was looking it up after I talked to you because I was like, where do they park? And it says there's one on Sutter. I don't even know where the entrance is, but apparently it's right here somewhere on Sutter. So apparently there's a Sutter
I got lost
garage.
yesterday at the parking garage.
You got what?
Lost yesterday at the one by Chase Center.
All right.
I had to go over there yesterday to the other UCSF campus.
Oh, gotcha. For another appointment?
Gotta go to a different one after I leave here at the China Basin.
Oh, gosh. You're all over today then.
Every day almost seem like.
You've got lots of different appointments.
Y'all like me, yeah.
All right, so kind of focus in on what's going on with you. Have you been to any kind of physical therapy before? Not pelvic, but just other
A little
types?
bit, yeah. I got a degree in kinesiology through physical therapy too.
Okay, great. So you have a pretty good understanding of the body and
Kind
the
of a
anatomy, which is good.
little understanding.
Okay. So it's going to be similar in a lot of ways. We're going to talk about what's going on, right? Your symptoms and what you're experiencing. We'll get into an assessment today as much as we're able, and then we'll get into some treatment. Try to give you some things to work on from there. Okay? So from the referral that we got, basically saying, the referral itself says you're having a hard time going to the bathroom, defecating, having bowel movements, which you did tell me over the phone last time we spoke.
Good, I'm glad I told you already. Yep.
Yeah, I think as you were saying, afternoon appointments at that time were better because of
It's hard.
what's
Yeah.
going on, yeah. And then the only thing other than that labeled in the referral itself is just that you have high pelvic tone, meaning there's tightness in that pelvic floor muscle system. So,
So I did have a fibroid that had like dislocated L5 and it got stuck in my S1 nerve root
okay.
and in my sciatic nerve, and then I had an L4 displaced too. So I don't know if that, but then I have endometriosis,
Mm-hmm.
and the endometriosis, I know it grew into my bowels. I don't know if it grows into the muscle. Excuse me, but I know for sure it is growth into my bowels and my GI. So
So it's taking a toll on a lot of different structures, not just around the uterus itself.
Yeah.
How long have you been experiencing these symptoms with the pelvic pain and the high tone and the?
I don't know. I haven't been able to use the bathroom now for almost 8 years.
8 years that you?
Yeah, I've been doing enemas for 7 years.
Okay.
8 years, almost 8 years.
Years.
Manual evacuation, not even just enemas.
Mm-hmm. And manual evacuation.
Yeah.
To empty. And when this started, did it sort of start out of nowhere, or did something happen around that time that this slowly developed? I'm just careful hitting the thing. Yeah, I don't want you smacking your head.
I got you thinking back way 2009. It's been going on a long, long time. But I think it started like feeling like I probably looked at it as constipation.
At first, it seemed like it was just that.
I think
okay.
because initially too, after maybe my second baby, I'm trying to remember exactly when my bladder was having a lot of like, every time I would like sneeze or cough or.
You're having like leakage kind of stuff? Okay.
Yeah, that was happening for a long time, and then it probably stopped around the time all this other stuff started. It seemed like.
Okay.
But first I was having that kind of issue, and then eventually, it started feeling, I guess you would say, kind of like constipation. I thought it was constipation at first.
But then it never improved or resolved, basically?
No. And then even with the enemas, it didn't help. And then like when I use the bathroom, I have to fold up like a bunch of towels and put them on my in between here and in between here, and so it got to cover.
So you like scrunch in like this?
Yeah, okay. But it has to fit perfect in between there, like push pressure between there and pressure up here. Pressure up both the sides.
So basically to assist with the downward movement that you need, use the towels for that.
Yes.
Okay.
And then I have to adjust my legs. Have to be adjusted exactly a certain way.
Okay.
So.
Do you use a stool then?
Sometime or whatever I got right there, or sometimes I just readjust my body because every different toilet is different too, right?
Yeah, if you have to go where you're not at home or something.
And then I done moved a few times in the last few years, so
you had to accommodate.
Each time is an adjustment. Each time.
Right now, do you have a pretty good setup with the toilet you have at home?
I have whatever I have.
Okay, so not.
It ain't a good setup, but I'm making work.
Okay.
It's an odd
so you don't.
Shape. Everything's odd there, so I have to.
Okay, like the height is weird. The
Everything.
Shape of the toilet.
Yeah,
you don't have a stool or anything that you can use at least.
I can't use a stool because it's too short and too elongated.
There's no room to kind of put it in the front. Okay.
Yeah, so
And then-
I just try to like put my legs up like this.
Which makes it even harder then.
Well, that's the only way I can get that angle.
Yeah, it's part of lifting stuff above
Yeah.
your hips.
Yeah.
Okay. So, I mean, there's more to talk about, but part of what concern I have though is if you can't get in a good position on the toilet, obviously, as you know, that's gonna make it challenging.
That's hard. That's one of the hardest
concern-
things.
Yeah, and the big concern I have with you having to do this to engage your back muscles here and the
Yeah,
calves.
that I have to use other muscles because these muscles not working. So a lot of times I have to pull up with my arms and pull up and
And
pull.
then that way you get that core working
Yeah.
too. But the one thing that I'm specifically concerned about with the calves engaging is when the calves are working, that can tighten up your pelvic floor unintentionally.
Oh, okay.
So that's why I'm like, oh gosh, I want to try to figure out a way that your feet can stay flat
Flat.
at least. Even if you have to pull up here, if your feet at least are relaxed and your calves are not working.
Now sometimes it wants to pull up.
Okay.
It's like a reflex.
Okay. Just to try to get you in that position
Uh-huh.
or to try to put pressure up. Is there an option to like
Even
set up,
even if I'm down there, my legs will still push up.
even if your knees are above your
Even
hips?
if because I got the towels right here, so
Yeah.
I'm on the towels. My legs will still push up.
Is there a way to not have to lean forward as much and bring your knees up to
No,
you?
because the toilet's so elongated.
Well, I'm sorry. I mean, like, can we think about like different types of things you could use to put your foot on, not necessarily like a stool?
So the toilet too low to the floor to put my feet up on anything.
Okay.
So it's like I can't put my foot up on nothing.
Otherwise
And then I
it
gotta
puts you too
constantly
high.
and then I gotta constantly adjust my legs. They don't stay the same way each
Okay.
time.
So that's something we gotta kind of
Yes,
look into
yes.
and see. Okay. How do you do in terms of? So right now you don't experience leakage anymore,
No,
except for
probably not in
before.
a long
Okay.
time. Yeah.
So no current leakage issues. And then do you feel like you have a lot of urinary frequency at all?
Yeah, a whole lot. Especially like when I gotta when I need to go evacuate, but I can't because I don't really get no sensation of feeling of either
You don't
one.
feel the sensation to go to the bathroom
No.
or bowel movement or okay.
No, but I'll start having it. I get like signs that I must need to go.
Like other types of pain or discomfort,
Yeah.
but not what you
Yes.
would have typically
Yes.
experienced. Okay. Is it more like a pelvic pain here that
Yes.
you feel or pressure? Okay.
Yes.
And are you getting up at night to urinate?
All night.
All night? How many times a night are you getting up?
Like every hour and a half.
Every hour.
Every
That's like
3
no
hours.
Sleep. Okay.
No sleep.
An hour and a half to 3 hours.
On a
kind
good
of
night, I
variable?
might go 3 hours.
Okay. 3 hours is like the max that you
Yeah.
take before. Okay. And do you empty a lot when you go to the bathroom, or you just
It
have the big
depends.
urge
Most
to
time
go?
it is a lot, and I sweat real bad. That's how I really know it's time to wake up out my sleep and go. It
Your
wakes me up.
body's sweating
It sweats.
a lot. Okay.
Yeah.
And that's in the last 8 years that you've had that kind of response.
The
to
sweat
needing to go?
since about 2000 and about 7-8 years.
Okay.
6-7 years. It hasn't been since about 2016.
And you've never done pelvic floor physical therapy before? Okay.
No.
No one recommended it, or just no opportunity?
I think
for
they
it?
did at one point, but I never did it for
Okay.
some reason. I think they did at one point a long time ago.
Okay. Okay.
But
And
they just now found out all this stuff wrong. That's why they're doing this now.
I see. In terms of your day-to-day, like nutrition, hydration, how do you do with like water and stuff
Bad.
throughout the day? Bad meaning you're not getting very much?
Not enough as I should, but I'm trying to work on getting more.
What do you normally average at, do you think?
At least 3 cups, 4 cups a day.
3 full cups?
Yeah.
And are you drinking any other fluids, water, coffee?
I drink a lot of stuff all day. I drink all day.
You just drink not necessarily water, other like fluids?
Yeah, it's just that's when I put stuff in my water.
Like flavored?
Yeah.
Okay, so you have more water, just not necessarily plain water.
Not the water that my body needs to absorb.
So something to give it a little, is it like those drops that you can put in?
Yeah,
your
like
flavor,
lemon
basically?
and stuff, lemon or something like that.
Okay, well, I mean, the flavoring's okay as long as you're still getting
Oh
plain
yeah,
water.
yeah.
The main thing I would watch out for is just like a lot of carbonated beverages or caffeinated
Oh
beverages.
yeah, I don't really drink a lot of.
Yeah, so you're not having a lot of coffee or
No,
caffeine
I don't drink
type stuff?
coffee at all.
Okay, no tea.
When I drink tea, I make my own teas,
Okay.
like from real herbs.
Okay,
I-
so you sort of
I
steep
put
your
'em-
own
yeah.
dried up stuff. Okay.
Yeah.
Do you have? Is it like a caffeinated or like herbs
Like
itself?
elderberry.
Okay, so
and,
non-caffeinated type stuff when you make a tea.
chamomile. Chamomile. Do chamomile got caffeine?
No.
So yeah, just regular herbs.
Just herbal teas.
Just herbs, different
that you make
herbs.
yourself. Okay.
Yeah.
So, I mean, with all the combo of those things, how much water do you feel like you're getting with the combination of the teas and the
Maybe
water
at
with the
least like
drops?
six cups a day.
cups
At
of all
least.
that?
At least.
Okay. And then how do you do with like your nutrition, like with fiber, fruits, vegetables, whole grains, that kind of stuff?
I get a good mix of everything.
Okay, normally.
Like today, I had yogurt and granola and peanut butter and jelly and chicken.
Okay, so yogurt, granola, peanut butter, jelly, and chicken.
Mm-hmm.
Have you had any vegetables today, really?
Not yet. It ain't
Okay.
vegetable time.
Okay, normally at dinner you might have the vegetables.
Yeah.
Okay.
Damn, you got me thinking about vegetables in the morning and shit
I
now.
know. Well, the thing is, I just want to make sure, and again, I'm not a nutritionist, but just that's a general thing that affects
Not
our
for my
bowel
bowels to
function.
start moving better. Yeah, some
Yeah,
green
we want to
vegetables.
make sure that you're getting a little bit of a good combo.
I don't have a problem with my bowels moving. I think everybody automatically thinks that is a problem. No. They move too much. They move. My bowels moving.
But you said you experience like the impaction where it's not coming out and you have to manually evacuate
There's a blockage. There's an actual blockage in there.
Okay, like the actual sphincter itself isn't opening up
There's
to let it
tumors growing in my bowels from the
out.
endometriosis.
Oh, that's what you mean from the blockage. Gotcha.
Yes.
But when you get the bowels out, then the quality and the formation of them is pretty
Oh
good.
yeah.
Oh, okay.
Yeah.
So that part's not not an issue at all.
No, so
It's just the
every blue
blockage
moon they
and the
real
pelvic
hard
floor
and
dysfunction.
small, but for the most part, no, I got good healthy poop and I poop a lot.
Oh, okay. Well, that's
Yeah, I'm not constipated. I don't need nothing to help me poop nothing extra. I don't want no
so
extra.
that's all good. It's really just.
Yeah, that's why I
trying to
eat
improve the
actually
muscle
pretty
function.
bad because I don't want to poop no more.
I see. Okay, well that's good. I'm glad we clarified that. Because
Yeah.
I thought, usually when we're dealing with bowel stuff.
I know most
you've got
people
a lot of other
automatically.
stuff
That's what
going.
people mostly.
I mean, part of it's usually, from our end, we obviously can't do anything about blockage, right? In
Exactly.
terms of that, but we can deal with the muscular component.
Right.
But
Try
I
to
always
help
just
make
like
it
to
better.
make sure that the background of that is looking good.
Oh yeah,
So it
no,
sounds
it's all
like
good.
that
It's all
part's
good.
okay.
It's all good.
And then you mentioned you've had the 2 pregnancies.
10 pregnancies,
Okay.
2 children.
2 deliveries.
Yeah.
Okay. And were they both vaginal deliveries or
Vaginal
cesareans? Okay.
deliveries.
Was there any tearing that you recall?
One of them I had to have it sewed up after some stitches after.
After first or second? Do you remember?
No,
Okay.
they grown.
Stitches. Some stitching or some.
I'm surprised I remember they mine.
How old are they?
19 to 24.
Okay. Are they local still, or are they?
Yeah. One of them just moved out my house, and then the other one still live with me.
Oh, okay.
For now.
That's exciting.
Yeah, I don't ever want them to move out because they're who I'm gonna live with the cats.
That's true. I mean, it's nice to have someone else in the house.
Yeah, I ain't living by myself. I'll go be homeless, sleep in my car.
Rather than by yourself.
Before I live by myself. Hell yeah, that shit is dead.
In terms of the pelvic pain and like the pressure that you experience, what would you rate that at its worst when it gets really bad?
25.
Okay, so it gets all the way up there. Does it
I
ever
be
go down to
screaming for my
0?
life. I can't see nothing but black.
Okay. Does that happen every day? A couple times a week?
The worst that happens
or
is
it
when I was
vary?
having my periods, but I don't have periods no more because they got me on that adjusting stuff.
Okay.
So whenever a period would come, that's when it would, yeah. I would be screaming for days.
Okay.
I don't like to take my mind to that memories.
I wish I had to talk too much about it. How about the pain when you just feel like that, like you described earlier, when you have the urge to go and what you feel is usually that
You
sweating.
just gave me
and the pain.
PTSD. I can't even hear you now.
Sorry.
I'm about to start crying and everything.
Okay, I'm so sorry.
What you ask? Just ask. Just keep talking.
So in terms of any, my last question was going to be out any pelvic pain related to intercourse. Or any
I don't have
history of
intercourse.
That. Okay.
Oh, but I haven't had intercourse in a long, long time. But
Mm-hmm.
a long, long time ago, it was painful.
It was painful in the past. Okay.
Yeah, that was probably over 15 years ago.
Okay. And I know you, well, I'm not going to bring that up anymore, but in terms of the pain, it was usually like a deeper pain. I don't know if you really remember at this point. But
I said pain. I don't like talk about the pain at all. It's, yeah, like you dying. I don't know.
Alright.
I don't want to think about it.
We won't talk about that anymore. Let's kind of go into what our rest of our assessment can look like, okay?
Keep talking.
Okay. In terms of the physical assessment, we want to look at a few different things, right? From our perspective and what we can help, like we were saying, is going to be muscular, right? So talking about any strength deficits that might be a component to your pelvic floor functioning like it should, or if there's a mobility component, right? Like, do we need to work on some tissue stretching and improve that?
Definitely some stretching and mobility, range of
yeah.
motion, yeah.
So what we want to look at is, we want to look all the way down. You mentioned some stuff in your back, so I want to see if there's a component that we have to address from your spine, or is it really just hips and pelvic floor, or just the pelvis itself. So what we'll look at is your movement in your back, whatever's available to you, and then looking at your hips and your strength in those areas. It doesn't have to be today, but what can also be part of a pelvic floor assessment is looking at your pelvic floor, right? So this can be done vaginally or rectally.
How do you look at it?
So it's an internal assessment. We basically set you up almost similar to a pelvic exam, except there's no speculum, there's no tool. It's a digital assessment, so just one finger assessment. We have gloves.
Okay.
We use water-based lubricant for the internal portion.
Okay.
So the main thing that we're trying to discover with that part of the assessment is what's your coordination look like?
Okay.
Can you squeeze those muscles? Can you lengthen those muscles?
And that's another thing. I have to cough a lot to help.
You have to kind of cough, bear down.
I have to actually cough to make the muscles push.
Change position. Okay. So that's part of what we would want to assess too, is what's your coordination look like, and then what do we need to do to improve it, right? Can you squeeze? Is that the problem? Or it sounds like you already are aware of the fact that it's more the letting go or lengthening that it doesn't want to do on its own without assistance. So that's part of what we can assess internally.
Because that's wherever it must hurts right there. It must hurt. Whatever causing that pain, it's the pain that's keeping it from wanting to do whatever it's supposed to do.
Yeah, and pain does that, right? It makes you want to guard, or the
it's guarding.
Be guarded.
It's guarding because whatever it's trying to pass up right there, I guess it hurts. So it guards every time it gets to that.
And that's the hard part. Like, we can't change what's passing, but we can try to at least give you tools
more
and
stronger
help the
to
mobility.
give.
So, do you feel comfortable with an internal assessment today?
Yeah.
We can assess those deeper muscles we can do it vaginally or rectally.
Either way, I don't care about.
So my thought is, let's look externally. Let's see what we find with your movement. Because sometimes there's enough there that we can work on without having to necessarily jump to the internal part right now. But let's start with that and see. In the future, though, I will ask: do you have like shorts or like stretchy clothes?
I was thinking that, but I was like, this is an assessment, so I could probably get away with my jeans today.
Yeah, well, most people don't. Yeah,
but next time I got you.
PT assessment, we're always making you move from the beginning.
Okay, I got you.
We can still do live.
But I got stretchies on under just in case.
Oh, okay. So
I was ready just in case.
Yeah. Oh, okay. So that works, because is it just like shorts or like?
No, they long stretchies, but they just like yoga pants or something.
Oh, okay, that's perfect. Then if you're okay with it, you can take the jacket off if you want, so it's easier to move around, and then you can just put the jeans and everything over there, and move around leggings, and then we'll go into a little bit more of a movement assessment, okay? And then I have no desire for you to push into any pain. Okay?
Alright.
So if something doesn't feel comfortable, you don't have to keep going because I asked you to move that way or move this
And
way.
a lot
okay?
of my pain is up here too.
You get on that left side up in the ribs. Okay. Is
So,
that all the time or is that with certain things?
with bowel?
With when you get the bowel movement going.
Yeah.
Okay.
Even when I just gotta go,
Mhm.
when I'm going, and like sometimes after for a
You
little
feel it
while.
on that left outer side. Okay.
Right. I don't know if this the outer side or the medial.
Okay. Is it okay if I poke?
Yeah.
Okay. Is it tender here?
Yeah.
Okay. And if I come out here, is it tender?
Right at that point.
Okay, so it's kind of along this whole line here. And I do wonder, I mean, it could be more from the back and just the way that your posture is and
Yeah.
where you have to be to like try to remove, the bowels and void the bowels, or evacuate, I'm sorry. But anyway, might be something we gotta check. We'll see. I'll have you get set up there. I'm gonna just write in that info as well. So with bowel movement, you said. Where'd you study kinesiology?
Cal State Hayward. Yep. And then I got my minor in physical therapy, but I quit because people don't be wanting to do the stuff.
What stuff?
Like
All the
when you
exercise?
when you make the plan to carry you the treatment, you doing it, they be fighting you and everything.
Yeah, that's true. That is a big part of
but
trying to
I
help
wasn't
people,
never
but-
feeling fulfilled from work.
Yeah, that is hard.
It was very weird that somebody was like, it was. So I just did X-ray
Okay.
instead of going to a DPT.
So
I
you're
did
X-ray technician or
X-ray
okay.
technologist, yeah.
Cool.
Instead of doing a DPT.
Okay. Well, that means if you said that to me, that tells me that you're gonna do your exercise.
Yeah, because
right?
I know better.
Okay.
Yes.
That's good. Well, you gotta let me know as we go, though, right? We're
Yes.
gonna work on stuff. We're gonna see what we need to incorporate, and then if something isn't working for you, we gotta adjust it. So you gotta let me know.
Exactly.
But for now, I'm gonna ask you to stand up.
All right, just straight up front of you, or
Yeah.
straight to this way.
Straight facing me. Do you want to put your phone down? Are you recording? Or are we live streaming?
Yeah,
All right. Okay.
They can see me. They
Okay. I'll have you back up a little bit. And then just go as far as you're able to tolerate. Don't go any further, okay?
Oh, I can stretch.
Oh, you're pretty
Touch my
flexible?
toes.
That's all.
I stretch like every day, at least a few minutes a day.
Okay, well, let me know as we go through what stretches you normally do.
Okay.
Can you reach down to your toes then? Let's see what that looks like. Okay, and then come back up. All right. Face that way for me. Are you able to go back as far as you're able?
Yeah, I do this sometimes.
Okay. Those two you do on a regular basis?
Mm-hmm.
Come on back up. Any pain with those movements or pulling?
There's tightness.
Just tightness. Where do you feel it? In the front?
In the front and in the back, and then
Okay.
here.
Okay.
My hamstrings.
All right. Face towards me again. And then we're going to go side to side here.
All right, I do this one, but I do it like that. But
For this one, I just kind of want to see how
yeah,
far your
like,
fingertips
yeah.
can go. Yep. And then the other way. Okay.
this
And-
one I got a lot of pain right here.
Okay, as you go to the left.
Yeah.
All right, come on up. Does it hurt on the way back as well?
Yeah, any move either way, this hurt. Yeah, I know what you're
Okay.
trying to check. Is it opposite?
Just a range
It's both,
and yeah,
both
it's
lateral
nothing.
and contralateral pain.
All right. And what about rotation?
Now, this only hurts when I turn to the right.
Only to the right? Where do you feel it though? In that same
In that same spot.
Okay.
And it relaxes when I go to the left. It loosens up when I turn to the left.
All right. Let me have you take a seat for a minute. Let me get the range of motion plugged in here. So when you went forward, did it hurt in the back? I forgot to ask you. Or on the way up or on the way down, or did you feel in the hamstrings?
In the hamstring mostly.
Okay. And then on the way back, you said just a little bit in the front.
A little in the front, yeah. But I do that one every day.
Okay. How many do you normally do when you do it every day?
I don't know, but I hold 30 seconds.
Okay, so you kind of just hang out there for 30 seconds?
I hold, yeah, I do hold, and I go to the knee, then I go to the hip, then I go.
You kind of just do like a
Yeah.
whole range? Okay.
Yeah, I do like 10 probably.
And it feels
sometimes.
okay, right? No pain with doing that? Or does
When
it hurt?
when I first started, but the more I keep moving, the longer I've been doing
Loosens
it.
up and it feels
no,
better?
no pain.
Okay.
Feels good to do it actually.
Okay. For the right side bend, you had a little pulling on the left,
On
right?
the left,
Yeah.
yeah.
The movement was all the way, but
I just moved through the pain because I'm so used to it.
yeah, you've been experiencing this for a very long time.
Yeah.
And then to the right was also, it was a little more limited though. You couldn't quite go
It's
as
on
far.
here. But it's still on the same on the pain
Yeah,
still
the
on the
same-
left.
the
Yeah. But
same
when I go
area.
to the right, yeah. Lose my breath.
With the pain.
When I go to the right.
I see. Okay. All right. So for this part, since I'm going to be in the frame, do you mind turning that off
you
for
got
now?
it.
Or I'm going to lay back.
Lay on my back.
Yeah. Lift it up.
You want to lift me up or you want me to lift? Stay lift.
No, I'm just lifting the bed up.
Oh, okay.
Yeah, you can lay all the way back.
Okay.
Yeah, you don't have to be up. Sorry.
All right.
I just meant you're going to be rising.
Okay,
just so
okay,
you don't get
okay.
disoriented.
Go on up.
All right. So what I'd like to check next, if you're good with it, is I'm going to check some passive range of movement in your right hip and then your left.
Yeah.
Okay. So I just want to see how things are moving.
Yep.
And you let me know if anything hurts while I do that.
Yep.
How are you feeling right now?
I'm feeling okay.
Okay. You sound a little out of breath.
I'm always these little
Just from the
movements.
motion. Okay.
The movements, like an old lady. I don't mean that in a bad way. Just like
Just
my
want
body
to check
been here
in
a
as
long
we
time.
go. All right. Let's check the right leg first. I'm going to bend the right knee.
All right.
Let it bend a little. Good.
Mm-hmm.
Okay. And then I'm going to try to straighten it first.
Mm-hmm.
Check that hamstring flexibility. Okay. A little stiff in there. Any pain or just feels like a pull
Where
in
you
and
stopped
stretch?
at was good.
Okay. I'm going to go in a little bit this way. Check your external rotation. Good. And we're going to go the other way and check your internal. Okay. Any pain with those motions?
No,
Okay.
you stopped right where it started getting
Yeah, I
tight.
try to go to end range. I don't need to push past that too much. We're going to do the same thing on the left side. I'm going to bend the knee. Okay. We're going to feel. Oh, that one's tighter, yeah. Which that left side's kind of generally tighter with that upper body
That's
too.
where I
it
got
sounds like, yeah.
the nerve thing
Right.
pinched.
Oh, it was on the left
It's
side.
on the
Okay,
left
that
side.
makes sense.
It's
Okay.
halfway crippled.
Okay, we're gonna straighten it down. You okay?
Yeah.
That was very stiff.
Mm-hmm.
Okay, I'm gonna put some pillows under your legs here. Hold on. Alright, go ahead and lift your legs all the way up and over. Good. And then relax. Okay. You feel a little better?
Yeah.
Okay, I felt like everything's being pulled and that with the legs straight like that. Alright, so you had a little tension on the right, pretty decent on the left.
And I always got pain right here that never leaves.
Right in the front. Okay. And we'll see how we do with time. I want to definitely, I don't know if we'll get to internal stuff today, but we definitely can get to some stretches.
What time is it actually? Because at 3.
2:40.
All right.
Is that okay time-wise?
Yeah.
Are you looking at the parking? Is that what
No, I gotta go to an MRI.
Oh, right, for your other appointment.
MRI today.
Is there a specific time we gotta get you
I
out
want
of here
to
by?
try to get there by 3:30, 3:45.
Okay, we should be good then, because I'll get
Yes.
you out of here a little after 3 at the latest.
Yeah, I
is
figured
the
that.
goal.
So yeah, we should be.
So we might not get to internal work, but I feel like there's a lot of stiffness in this belly,
good. How you
okay.
know?
just based on everything you told me.
Oh, yeah.
And the fact that you have a lot of pressure here.
Yeah.
Well, I mean, I'm seeing you move, right? We get some idea. So what I want to see is assess and see if I'm right, right? Yeah. And you kind of told me that too. You were talking about how it feels tight going back and things like that. So that gives me a little information. So if you're all right with it, I'll have you lift the shirt a little bit.
Okay.
And then let's see where the... Okay. And then do you mind tucking the shorts down just a little bit?
Yeah.
And then is it okay if I use a little lotion?
No, you're good. You tried to say I'm ashy.
Huh?
You tried to call me ashy. You tried to call me
no.
dry.
Oh, I was like, what? I thought you were saying Ashley.
Dry.
No, it's just easier. It's that way I don't feel like I'm pinching or
I'm
getting,
just
I don't know,
joking.
you're messing with me.
Yeah.
All right, see. I mean, just laying here, it looks a little stiff already. Let's see.
That's what I said. That was a
So
good
I
guess.
You have what?
Good guess.
We got. Let's see. We're gonna
Feel
start
like
on
I'm
the right.
18 months pregnant.
Oh, does it always feel a little bloated like that?
Mm-hmm.
Okay.
I don't call it bloated. It's more like a pain. It ain't a bloated feeling.
Oh, okay. So I'm just gonna start light and just see what I'm feeling under my hand here. Any tenderness there?
And not on that side.
Okay. We're gonna work our way to the side that you have more of the pain.
Right there's tender.
Okay.
Right there.
And I work my way
Right
down
there,
all the way
mhm.
through. Okay. So, if you're okay with it, I'd like to do a little massage through here. A little
Mhm.
abdominal massage, a little
Mhm.
fascial kind of mobilization through that area, just to see if we can take some pressure off the abdominal wall.
Mhm.
Okay.
I'm dancing.
And you let me know if anything's too much. Okay.
Mhm.
If anything's super sore, if we need to lighten up the pressure. So I'm going to start on the right again. I know that's not where you're having pain, but there's a little tension here, probably because this right side might work a little harder since that left side's a little painful, and it might be weaker because of that too. So we'll see. Do you feel like you're letting your belly relax completely?
Mhm.
Okay. I just want to make sure. Are you familiar with diaphragmatic breathing then? Good. And you kind of keep focusing on nice steady breaths, okay? So do you have a following online? Is that why you're live? Or
A little bit. They nosy.
they want to know how your appointment and everything's are going?
They just be want to know everything. This TikTok.
Oh.
They want every detail.
Let's see.
They think it's on TV.
You're there. Oh, they're TV. They're watching your life like a TV show kind of thing. You mean?
That's how
I
TikTok
see.
kind of is sometimes.
I guess that makes sense. All right. How are we doing with the pressure? You okay?
Yeah, but they really just be trying to be nosy about this situation.
About your symptoms and your
Mhm.
experience with that.
Mhm.
Okay. Were they streaming on your first appointment today too? You said you had another one
They
this
always
morning?
did. They nosy. They be talking like they got to say so in there too. I just be ignoring them.
Oh, okay. Doing all right?
Mhm.
So I'm going to come a little low here, and I'm going to do a little bit of a upward stretch. Okay. Do you ever do any belly massage? Or have you had that done before?
When I can get someone to do it for me, I try to get someone to do it.
Okay. Try to relax the belly. There we go. You were talking, and the first thing your belly did was try to hold everything in.
It's take a lot of energy to talk.
Yeah. Maybe I'll let you not talk for a while. Sorry to keep asking questions. Alright, I'm going to switch over to more of the left side here. So see how you do with the manual work, right? Because sometimes people feels really good, and sometimes you get sore, right? Because your belly's not used to it, or you don't get that kind of work very often, so you might be sore, and then it calms down, and it feels better, or it feels looser, maybe feels less pushed or stretched out or pressurized and pelvic, see how it feels. And that way we have some information of how you respond to the abdominal work from me, and then we can kind of use that moving forward as well, along with the other things we're going to work on. In terms of other stretches, I'm just going to try to talk at you a little bit so you don't have to talk too much, so you can take a break. But you had mentioned you're doing the spine sort of movement. You're doing like a little sequence with that when you work your way up. What I also want to include is some hip stretches, and I'll kind of mention them. If they're familiar, you just tell me. But a little bit of butterfly stretch and happy baby. Are you familiar with those?
Probably not by name.
Okay, so the butterfly stretch looks like you're laying on your back or you're sitting. Feet come together, knees fall apart. And you stretch like the inner groin
I do
area.
that one. I didn't know that was called that. I lay
There's
down in my
lots of
bed
different
and do
names.
it.
You can call it an adductor stretch also, but that one can be helpful.
It does. In the middle muscles. My adductor muscles.
Yeah, it feels good on that. Okay. How long do you normally hold that stretch?
30 seconds.
Okay. I want you to try to increase that to 2 minutes.
Okay.
Oops, sorry. Slowly, but you don't have to start right at 2 minutes, but try to increase to 1. And if you have to break it up, that's fine. Like, you can do 30-second increments, but I want you to try to get to a total of 1.5 to 2 minutes if you can. Okay, and while you're there, if you aren't already, I want you to be conscious of trying to do some breath work. So letting the belly totally relax with
I'm
the
trying to work on
inhale. Yeah, so applying that while you do your stretch too, if you can, okay? Okay, is it okay if I sink a little bit in here into the hip? Okay, and then go through that left hip flexor area here. With the pressure, is the pain tolerable? Does it stay the same? Does it increase and then calm down? What are you noticing so far?
The pain, it kind of, it stays the same, but it just, it feels a little bit like, it feels a little euphoric or whatever you want to say when you press over it a little bit.
It feels a little what when I press on it?
Like a little euphoric, like, I don't know what to feel if you explain it. It don't feel good or feel better, but I don't know. It's just like a, I don't know how to explain that feeling. I don't know how to word for it.
That's okay. We'll kind of keep it for that for now. Do you do any regular, like, strength exercises already?
On my stomach, no, not really, because it's real weak. As soon as I talk or anything, they tighten up real bad.
Okay. I'm going to move to the left a little bit more. Okay, so this next one I'm going to sort of press in a little bit, and then we're going to stretch like that. Is that all right?
Mm-hmm.
Give your belly a break.
That felt good.
Yeah, I felt like the belly relaxed a little bit more with that one.
Mm-hmm.
So something for us to keep incorporating, okay?
Mm-hmm.
So the next thing I want to go over is that happy baby stretch. There's a few ways to do it. You're in the perfect position to start with, okay? We can do one leg at a time and see how it feels.
Okay.
Basically, the goal of the happy baby stretch is to start working on some pelvic floor lengthening or relaxation, okay?
Mm-hmm.
So one leg, and we'll start with the right one since that's a little more flexible. You're going to bring the knee up towards your armpit and grab behind the knee here. And then we're going to go into like a little wide hip stretch. There you go. And you can do both of them at the same time, or we can just do one and then... So this is my modified version of happy baby. Full happy baby is where you grab your feet, but that's usually not relaxing for most people. So this is a little bit nicer to start with.
Sometimes I do both and then I put my feet straight up while I'm holding my feet.
With your knees bent a little?
Yeah, I'll do like
yeah,
this
so that's more the full happy baby. Yeah. And
I
that's
didn't know
fun.
they had a name for it.
No, that's okay. Well, that's why, right? I was like, you've probably done it. You just don't call it the same thing. There's lots of different names for stuff. The main thing is I just want you to do this version of it because I think you could be a little more relaxed, because my concern with the full version is your belly's working too hard. And when we do a stretch, at least with these ones, I want you to be as relaxed as possible. Yeah, I don't
because
need
that was
anything.
really tight.
Yeah, so
So
I don't
put my
want
leg up.
exactly.
Even flexing my
Yeah, so let's not flex too much because that puts a lot of tension on that back line of the hamstring and into the calf. So
Is it
one
alright
leg.
to hold it like this?
Yeah, that's perfect as long as you can kind of breathe through it and relax into it. Ideally, the goal is similar to the butterfly or the adductor stretch. You're trying to get about 1 to 2 minutes of a stretch. You can break it up as you see fit. Trying to work up to that full 2 minutes if you can, okay? And because we're doing one at a time, you can do this a few ways. You can do a full 1 to 2 minutes on one leg, then switch. Or you could break it up, 30-second, minute increments, and then switch to the other leg. That's another option. You falling asleep?
I feel good.
Oh, good. I'm glad. I want it to be a relaxing stretch, so I'm glad it's enough where you feel like you can fall asleep. The other thing that's nice here is because the toilet position stuff at home isn't ideal, this at least is helping you mimic that ideal position, so it's getting that pelvic floor in a better alignment. Even if it's not necessarily on the toilet, at least we're still working on that lengthening position, okay? So if you can, let the right leg rest down. Let's try it on the left. I want to make sure it feels okay on both sides. Okay. And then this side may not want to stretch as much, so if you need to, come out a little bit so you don't pinch too much, or is that too intense? Okay, yeah, if we're squinching and tightening up, then that's not ideal. Seems like that's too much. Tell me what you're feeling. Thumbs up, that's where we're at, okay. Do you feel like you can settle into it now that you're in the position? Okay. So monitor this one, see how it feels, okay? If you can settle into it like this and hang out there and try to slow down your breath, then work it in. If you can't, we'll back it up, okay? So for right now, I want you to add this one and the butterfly stretch. The other thing I want you to do, if you can, I know you said it's nicer when someone else does it, and that is true, right? When someone else massages, it always feels more relaxing. But if you're able, you can at least just do some circular massage, starting kind of wide.
I rub my belly.
Yeah, so doing that just daily. Yeah, I would just recommend starting out and working your way in. That way you get the full abdominal area in the front a little bit more, okay? And then adding those 2 stretches. The other thing, if you aren't already doing it, go ahead and rest the leg down, is adding a little, adding a little, what am I trying to say? Breath work daily. Okay. You okay? Feel like you're scrunching your face. Is something hurting or is it just more positioning?
Just gotta relax.
Okay, good. But breath work, so focusing on that deep, slow breath. I want you to try to hone in on taking your time on the inhale and the exhale. Meaning when you breathe in, you're trying to take 3 to 5 seconds to breathe in, take 3 to 5 seconds to breathe out, slow and steady, okay? Mostly just because when we start breathing in and out, sometimes we start doing it quickly, and that's kind of counterintuitive to what we're trying to do, right? We're trying to calm that nervous system, bring it into that relaxation mode, and fast breathing doesn't quite help us do that as much as we like. All right. So would you like a handout for those things? Okay. So you can stay relaxing here. I'm just going to bring the bed down so when we're ready you can sit up easier. But let me get that print out, and we'll figure out our next appointment time. Okay? You all right? I will ask you that like 5 million times. That's a normal question. Let me throw this out. And then just a reminder, it looks like the parking garage is called Sutter Street Garage for future if you want to look into that next time.
Okay, I just signed up for the one that's on the street right there.
Oh.
So next time I come, I'll just scan it and...
Oh, okay, if you already did that, then that works.
Hopefully if it's a park there, hopefully this wasn't a fluke that they had an open park.
Okay.
It's not too far of a walk.
Gotcha.
I think I saw that garage. That garage is like this right here.
Okay, yeah, it makes sense.
When I was walking.
On the street right here somewhere. I just don't know.
Okay, that must be the garage that I thought was for that building, but so anybody can park in there.
I think so. That's what it looked like.
I worked at there before. They got a surgery center in there or something, right?
I I actually don't even know.
I think so. Yep, I worked up in there
Okay.
before a long time ago. Because I did an x-ray for their surgery.
Oh, okay.
Yeah, that was some years ago. I forgot about that.
So the picture I'm going to show you for that hip stretch or happy baby stretch
Mhm.
shows both knees up at the same time.
Mhm.
You just do one, okay?
Okay.
Another butterfly stretch. And then again, the big thing with those stretches is I don't want you to just hang out in the stretch or
Okay.
tense up to try to hold the stretch.
But the one you
want-
wanted me to, the last one, right?
I don't want you to tense up anything. I want you
Okay.
to pull it in, but only up to the point where it feels like a gentle stretch and you can breathe through it.
Okay.
If you can't breathe through it, it's too intense.
Okay.
Okay? That's my big thing. I want you to be able to breathe through whatever I give you and come into a more comfortable position. If that doesn't happen, we need to adjust what we're doing. Okay?
Okay.
Alright, we'll print. In terms of frequency, normally I like to kind of spread out visits to every other week. Because you've been dealing with this for so long ago, I'd like maybe our second or third visit to be a little more frequently to start with, to build up your program, to see how you're responding to the ones we gave you already, and
Okay.
then we can wean down from there. So for the next visit, do you think it's an option for you to come next week?
That's fine.
Alright, we'll see if any of the times work. That's the
I'm off of
main
work
thing.
until February.
Okay.
So whatever visits I need to do.
Okay, let's see if we got, okay, I was like hoping I had something in the afternoon next week and I don't think I do right now anyway.
And I think I only got one other appointment next week, so that way it won't be too much of a.
Right now I don't have any afternoons next week.
Yeah, I could.
If
What
that
morning?
changes-
What morning? What day you got morning?
I had only, I think, one morning.
What time? I'll try to make it for you.
The only time I have right now, let me just make sure, because I was looking at the morning, I think it's just that Monday the 6th.
The 6th.
And, yeah, because the 10th we're off is the other reason that.
What time on the 6th?
8:45. That's kind of early.
No, that's probably good. It's probably better if I come early. Then I can go home and do my therapy. That'll just be the end of my day.
Okay, as
That's
long as
fine.
you're, just because I'll have someone right after, so just make
No,
sure.
that's fine. That's fine. The
And
next
then
Monday.
and if anything changes before the end of the week, like someone cancels next week in the
You'll let me
afternoon,
know.
I'll let you know, I'll message you on my chart, so just look out for that.
Okay.
And then we usually just schedule one at a time, so next time we'll talk about our next appointment, okay?
Okay.
Alright, let me
Sounds
have you
good.
bring your legs up slowly, and then make your way to sitting, and I'll go grab that, bring out the 8-6, which will be pretty soon, but after that we can try to make it a little bit more spaced out.